Now let's see what kind of hyperkinesias can be there. Okay. There are different types of hyperkinesia. We can say there are choreas. There is athetosis. There are dystonias. And there are balismus or hemibalismus. All of them are excessive movement, and there are tardive dyskinesias. I will explain all of them, don't worry. I think you will worry more now if I explain. Tardive dyskinesias. Okay, there are others also, but let me explain these first. Okay, Wilson's disease. Chorea has Huntington's chorea. Chorea also can be part of Saint Vitus dance, or Saint Vitus dance is also called Sydenham's chorea. Sydenham's chorea, and there's another disease called Wilson disease. I will explain them one by one. In all of these diseases, the dominant lesion is in indirect pathway. So in all of these diseases, movement will be less or more. Yes? There will be excessive abnormal movement. Now first of all, chorea. What is chorea? Yes, it's North Korea or South Korea? Yes, what is chorea? Have you seen Michael Jackson dance? Michael Jackson dance is somewhat like chorea. Sudden, brisk, purposeless, flying movements of the limbs. Uncontrollable. What is this? Chorea is basically damage to this system, right? And when this GABAergic neurons in the, caudate nucleus are damaged, especially not in putamen. When GABAergic neurons in caudate nucleus are damaged, striatum, right? What really happens? Indirect pathways dysfunctional, right? And many motor programs are abnormally released. I will tell you exactly how the chorea is produced. Many motor programs are abnormally released. What I told you, that when this pathway is inhibited, then actually, it should be here. When this pathway is not working, eventually what will happen? Motor cortex will be understimulated or overstimulated? Overstimulated. Now, if motor cortex is overstimulated, or from this area overstimulatory signals are going, now in your central nervous system you have different program. For example, this is a program to raise your hand, right, and salute someone. This is the program to bye-bye. There's another program you can run, for example, right? There's another program. Now these are different programs which are there, and you only use them in specific situation. Now if indirect pathway is disturbed and motor cortex is overstimulated, it may release multiple programs in a haphazard fashion. For example, you are going to salute, but half of the movement suddenly it goes like this, and then suddenly another program is leaking of the program, right? Inappropriate release of the program. For scratching here, but you come here, and then suddenly goes like this. So what happens? In chorea, from central nervous system, motor programs which are stored there are haphazardly released, or their components are released, and they result into sudden, uncontrollable, or involuntary, purposeless movement. You understand? Chorea. So it's just like a Michael Jackson latest dance. Is that right? Now, how chorea can occur? One chorea is Huntington's chorea. You will study in detail in pathology. But I will just tell you, in Huntington's chorea what happened, that problem is, it is inherited disorders. In Huntington's chorea, chromosome number 4. On chromosome number 4, there is a special gene which is called Huntington gene. In this gene, trinucleotide repeat, CAD, they are amplified. trinucleotide repeat are amplified, and when trinucleotide repeats are too much amplified, that produces an abnormal protein which is toxic. That toxic protein damages the GABAergic neuron as well as cholinergic neurons. Is that right? So what will be the result? Basal ganglia dysfunction, and that will result into coriform movement. With that, these patients also develop depression and dementia. Is that right? And in chorea disease, all the features of trinucleotide repeat diseases are there. For example, trinucleotide repeat diseases get progressively worse generation after generation. So Huntington's chorea also get worse generation after generation. Father has less chorea and son will have, or less severe disease, son will have more severe disease, grandson will have very severe disease. Secondly, because after every generation, trinucleotide repeat amplify, disease get worse. Why the trinucleotide repeat amplify? Because during oogenesis or spermatogenesis, trinucleotide repeats are overcopied. So children have more repeat than the parents. You understand me now? So generation after generation, Huntington's disease get more severe and appear at younger age. Is that right? What happens in Huntington's disease? That especially head of the caudate nucleus degenerate, and lateral ventricle looks as if it is abnormally widened because head of the caudate nucleus is no more occupying its normal anatomical position. Am I clear? Or should I draw a diagram? It's really clear. She just want to leave the lecture now. I understand. Okay, so Huntington's chorea is inherited disorder, autosomal dominant, related with trinucleotide repeat amplification. Disease get worse generation after generation, and the disease appears at younger age, generation after generation. Is that right? Because trinucleotide repeat over amplify during gametogenesis. Is that right? And trinucleotide repeat which amplify, they consist of cytosine, what is this? Adenine and guanine. But you can remember caudate nucleus having less acetylcholine and having less GABA. Caudate nucleus having less acetylcholine and less GABA. Cholinergic and GABAergic neurons are damaged. Patient has classically abnormal motor coriform movement. With that there is, what else is there? With coriform movement, depression and dementia. Is that right? Then there is St. Vitus dance, or other name is Sydenham's chorea. This type of problem is more common in girls, and this is seen, this is another type of chorea, purposeless, sudden, brisk, uncontrollable movement. If you really want to have chorea, try to get this one, not the other one. Huntington's, if it once starts, it is progressive. St. Vitus dance or Sydenham's chorea is transient chorea. It occurs in the patient with rheumatic fever. Some people, especially in younger age, when they get streptococcal infection with beta hemolytic organism, right? Some of these children develop cross immunological reaction, and that immunological immune system which is supposed to, when streptococcal infection produce sore throat, immune system should specifically fire back against the streptococci, but unfortunately immune system also produce some component which react with our own tissues. It means immune system cross react. We are supposed to fire against the bacteria but also fire against our own tissue. And if this immune reaction injure the caudate and produces inflammation in caudate, then patient may get chorea. But usually it is short-term chorea, right? When this, rheumatic fever become okay, chorea will be terminated. Am I clear? Then there is another disease in which chorea can occur, that is called Wilson disease. In Wilson disease, what happens that this is inherited disorder of copper metabolism. That there is a protein called ceruloplasmin. Ceruloplasmin level is less in the blood, and copper accumulate into liver, and copper accumulate in the cornea, and copper accumulate into caudate nucleus and lentiform nucleus. Right? So it damages the liver and damages the lenticular nucleus. So we call it hepatolenticular disease. What we call it? Hepatolenticular disease or Wilson disease. It is copper overloading disease, right? In which in the blood, in the liver, copper is more, in the blood, ceruloplasmin is less, and urine loses a lot of copper. There's excessive excretion of copper in urine. Now, in these patients, when copper damages the liver, patient develops cirrhosis or liver failure eventually. When copper damages the basal ganglia, patient develops coriform movements or dystonias. And when copper deposits into cornea, in the cornea there's a decimase membrane. You must have studied in anatomy. You don't know there's cornea? Yeah, cornea. Cornea is one of the layer which is called decimase membrane. Copper loves to deposit there. And when copper deposits into decimase membrane, it makes a special ring in the cornea. That is called Kayser-Fleischner ring. Right? I don't know the spellings. You can write it like this. Kayser-Fleischner ring. Right? So Kayser-Fleischner ring is deposition of copper in the cornea. In which disease? Wilson's disease. This is hepatolenticular disease. Is that right? Cirrhosis can occur in the liver and it can damage the basal ganglia and produce abnormal motor movement. Clear? Yeah, it is damage. It is progressive damage and it is related with chromosome number 13. Right? This genetic inherited disorder. If you are really desperate to get chorea, try to get Sydenham's chorea. Right? That occurs in children usually between 4 to 14 year, 15 year or up to 20 year. All of you are above that. But rheumatic fever may have chorea as a part of it, right? That is Sydenham's chorea. Or sometimes females when they get pregnant in second trimester, they get the Sydenham's chorea. That is also called chorea gravidarum, that chorea of the pregnancy, but it's rare, don't worry. Okay, you want to know rheumatic fever? Okay, very briefly I will tell you. Rheumatic fever, what happens? Special type of streptococci, beta hemolyticus, Lancefield group A, rheumatogenic strain. These special strain attack the throat. Most of the people, when they get this infection, most of the children, they make antibodies which only damage the bacteria. We are happy. But in 3% of the children, unfortunately, when these bacteria attack the throat, immune system fire back against the bacteria, but also attack some of our own tissue which have some antigens which are like bacterial antigens. It means the immune system is really stupid. Rather than making very specific antibodies against the bacteria, it also makes antibodies which also cross-react with our own tissue. So those antibodies may cross-react with our cardiac tissue or with the synovial membrane. So patient may have carditis, myocarditis, pericarditis or endocarditis or polyarthritis, and skin lesions, or he may have chorea or some nodules in subcutaneous tissues. You will study this in pathology one day, hopefully. Right? Anyway, so Huntington's can produce chorea, which is due to degeneration of GABAergic and cholinergic neurons, right? Wilson's disease can produce chorea, copper deposition there. St. Vitus chorea when immune system attack the basal ganglia, but it is transient. Clear? And what is acetosis? Chorea, you know it is Michael Jackson dance. What is acetosis? Have you seen Indian dance? Indian classical dance, Kathak dance, or have you seen Indian dances or not? Okay, if you really have some time to see Indian dances, they are not haphazard movement like Michael Jackson. They are different. Usually they move their hands in a very artistic way, slow rhythm movements, right? So these are Indian dances. What is happening? The movements are in the hands or distal part of the limb and they are slow and sinus. No jerk is involved. As if one movement melt into other movement and other movement melt into third movement melt into fifth movement. You get it? Very artistic movement. Sometimes patient does not want to dance, but these movements are automatically released from basal ganglia. And person is having slow sinus rhythm movements of the hand. Right? These movements are called what? Acetosis. Right? Again, this is a damage in indirect pathway and excessive stimulation. Is that right? All those diseases which can produce chorea, they can also produce acetosis. For example, listen now, it's very easy to understand. If motor programs are haphazardly and rapidly released, that will produce chorea. If motor programs are released very slowly but automatically, without any will, and one movement convert into other movement smoothly, this is acetosis. So many patients have chorea and acetosis both. We say patient have choreoacetosis. Is that right? So you have Michael Jackson dance here And here you have Indian classical dance. Now we come to the dystonias. Dystonias are when the muscles, especially the axial muscles or truncal muscles, they are over-contracting in a very prolonged fashion, like this. And it remains like this. This is called dystonia. And if in some dystonia, neck is bent like this and very painful, right? We call it torticollis. Have you heard of it? So dystonia, here what is happening? Which movements are over-released? Which movements are over-released? Truncal muscles, axial muscles. Is that right? Again, when sudden jerky movements, uncontrollable of the limbs, what is that? Purposeless movement, yes? Chorea. And distal part of the limbs moving in a slow sinus movement, athetosis. And if these muscles for a very long time like this and then like this, what is this? Dystonias. And then there's hemibellesmus. This is very dramatic. Have you seen Arabic dance? Yeah, you are not really dance people, right? Okay, anyway, you know Michael Jackson dance is what? Chorea. Indian classical dance is athetosis. Now, if you see really classical Arabic dance, you have seen? What is the special feature of that? It's very different from Indian dance. Yes, there are violent hip movement and shoulder. I really don't want to show it. I don't know how to do it. But something is happening very drastic to the woman who is dancing, right? We call it ballet dance type or something, right? You understand it? You know ballet dance. Yeah, every man knows it. Okay, now, actually, if you really imagine a woman who is Arabic dancer and unfortunately she has some problem in basal ganglia, she will have very dangerous dance, very provocative, right? Now, what really happens that kind of dance can be called balismus, or if it is half of the body, hemibellesmus. Let me tell you how it comes. Actually, there's a damage in the subthalamus. There's damage to subthalamus. This is classically seen in patients with hypertension or with diabetic patient. That when they were sleeping, maybe the artery which was supplying to subthalamus that underwent thrombosis or hemorrhage. And there's a small infarction of subthalamus. Very little infarction. But in the morning, patient will find that he is having very dramatic, it is one of the most dramatic presentation in clinical medicine. You know what will happen? When this is, listen, when this is, what is this? Infarcted, remember, there are two subthalamus or one subthalamus? There are two. Now, if this is, suppose, left subthalamus, these fibers will be controlling the left cerebral hemisphere. From there, corticospinal fibers come and cross to the right side. So if damage is to the left subthalamus, the clinical features will appear on the contralateral side. Or if clinical features are on one side, subthalamus is damaged on the contralateral side. Now, the subthalamus specially control the hip girdle and shoulder girdle. Is that right? Now, if this is damaged, indirect pathway is gone. And there's excessive movement, especially about the hip or shoulder girdle. Now you imagine, if person is having a sudden movement of the shoulder, what will happen? This air will go like in a ballistic fashion like this. This arm will go suddenly like this, right? Or hips will suddenly move and leg will be going to I don't know where. Is that right? So usually it happened to one subthalamus. So half of the body is having violent jerky movement of the limbs initiated from abnormal movement of shoulder girdle or hip girdle. You are understanding? If it is unilateral, we call it hemibellesmus. If it is bilateral, unfortunately, we call it bellism. Am I clear? Any problem up to this? All of these are dyskinesias. All of them are produced due to abnormal function in direct pathway, indirect pathway. Indirect pathway. Again, sudden Michael Jackson dance. What is that? Chorea. Indian dance is what? Athetosis. Chorea is sudden purposeless movement, uncontrollable movement of the arm, right? These are sinus slow movement. Dystonias, axial muscles, or truncal muscles in high tone. Hemibellismus, one limb or other limb is flying in the air, right, due to sudden movement in the shoulder or the hip girdle, right? So what is this? It's like Arabic dance, very violent movement of hip or shoulder region, right? You can understand why shoulder region. Now, last thing which is left is tardive dyskinesia. Tardive dyskinesia is a disease which occurs in those patients who are taking dopamine receptor blocker. Normally we give dopamine receptor blocker to those patients who have psychosis. You know what is psychosis? Schizophrenia type thing. Psychosis is the severe mental disorder in which you have lost the contact with reality. Is that right? So in psychotic patient, one of the way to treat them is giving dopamine receptor blocker. Now what happens? Attention please. If you are giving a patient dopamine receptor blocker for very long time, if you're blocking these receptors for a long time, what will happen to receptor? They will down-regulate or up-regulate? They will up-regulate. If you are blocking the receptors, then cell will produce more receptors. If you are overstimulating the receptor, then cell will produce less receptors. Wow, this is a very basic concept. Look, this is a cell, this is a nucleus, this is the gene which produces a specific receptor. Right? Now, if these receptors are totally blocked, no action of the receptor is produced. Genes assume as if there are no receptors. So they will produce more receptors. You are understanding? So what happens? This is upregulation of receptor. So what happens? Those patients who are given antipsychotic drugs, which especially block the dopamine receptors, right? Sometimes prolonged use of such drugs will lead to upregulation of dopamine receptors in striatum. We say the tissue become hypersensitive to dopamine, and this regulation will become disturbed. Now you see, if there are too much receptors of dopamine here on indirect pathway, then it will be excessively inhibited. Will it be inhibited or not excessively? Dopamine through D2 receptors inhibit the indirect pathway. You are understanding? So it is just like damaging the indirect pathway. And again, what will happen? Dyskinesias will be produced. Usually this type of problem occur in older people, usually in females who are 50, 60, 70-year-old, and they have been given antipsychotic drug for a long time, and they develop very strange type of choreoathetotic movement or abnormal movement. You know what are these? These are usually in their lips and tongue and in this area. Probably the basal ganglia which control this area, there's a lot of abnormality. And these unfortunate old females, previously they had a trouble, they were psychotic, and now they develop a new trouble after using the drug for a long time. They have abnormal movement of jaw, lips, tongue, and all the time. What they are doing? They are like a fly-catching movement of the tongue, or smacking the lips, and they cannot control it. They cannot control it, right? I'm not going to do it again, right? So, what happens that this type of movements which develop abnormal orofacial movement, uncontrollable movement, lip smacking their own lips, lip smacking or tongue flying movement and tongue not flying, fly catching movement, as you have seen frog catch them or something, right? All these movements uncontrolled coming, this is called tardive dyskinesia.